Hello everyone, we are from Group B. Today, we will be demonstrating on how to counsel patients regarding lifestyle modification, specifically on exercise. For today's scenario, we have Mr. John, a 48-year-old man, came to the clinic to seek medical advice prior to starting his exercise regime. He is planning to start his exercise soon. He has had dyslipidemia for the past 3 years, but he is reluctant to take any medications. Let's take a look.
Okay, that's very good. But before that, is it okay if I ask you a few questions just to know a bit about your background?
Yeah, okay.
Are you physically active in your daily life?
Not really, because I work 9 a.m. until late at night as a accountant on my laptop, so usually I don't really do anything.
Understand? How about weekends though? Like, do you have any hobbies, and are your hobbies related to physical activity?
Actually, still busy as a accountant on weekends also, so I don't really spend a lot of time working out. Usually I like to spend my time reading on my laptop, things like that.
Okay, no worries. We will later discuss on the types of activity and exercise that you can do later. So, what about your diet? Can you tell me more about what you usually eat?
I try to eat the suku-suku separuh, yeah, but sometimes I eat, sometimes I don't.
Okay, it's okay, but there's some effort there. Okay, so do you smoke or drink alcohol?
No, I don't smoke.
No, okay lah, that's very good. Okay, so based on the information you have given me so far, I think we can work something out for you, okay? But before that, is it okay if I take some of measurements and also do a physical examination on you?
Yeah, okay.
Doctor, I'm a medical student. Can I help take the height and weight for this patient?
Yeah, sure.
Okay. So, Mister, can you please take off your shoes? I will measure your height and your weight. Okay, stand on this scale. Can you face this side? Okay, and just look forward straight ahead, okay? Okay, so the patient's height is 170 cm and the weight is 90 kgs.
Okay, good.
Okay.
Hi, Abigail. Everything okay? Hi, Prof. We have Mr. John here. So he has obesity and dyslipidemia. I'm actually planning to start him on an exercise therapy. Are there any precautions that I should take note of before starting him on the exercise therapy?
You need to make sure the patient is fit enough to start on the exercise regime. Is Mr. John fit enough prior to this?
Pre-exercise screening is what we provide to patients who come to us seeking to start an exercise program. So our goal here, aside from the typical history-taking, physical examination and investigation, is to investigate whether the patient's underlying comorbidities, or especially to check whether the patient has any cardiovascular abnormalities or musculoskeletal abnormalities that will be exacerbated or potentially complicate the patient once they start exercising.
Hi, Mr. John. Do you have any chest pain or any discomfort recently?
No.
Okay. Do you have any shortness of breath? No. Okay. When you are sleeping at night, do you wake up due to any shortness of breath?
No.
No. Okay, that's good. How many pillows do you use at night?
One.
Okay. Do you sometimes feel your heart beating very fast? No. So okay. And then is there any fainting episode before this?
No.
Okay, that's good. Any history of heart diseases in your family?
No.
Okay, that's very good. Currently, do you have any knee pain or back pain?
No.
Okay. Abigail, so I think Mr. John is fit enough for the exercise regime because there are no any cardiovascular or any musculoskeletal system symptoms. So let's say if you meet this kind of patient with any cardiovascular risk factors, you must always need to order an exercise stress test to rule out any cardiovascular diseases. And let's say if the patient has any knee pain, back pain, any musculoskeletal diseases, you need to treat the underlying medical conditions first, make sure the patient is fit enough.
So, Mr. John, my professor has assessed you just now, and she thinks that you are fit enough to start on an exercise regimen. So let's talk further about the exercise regimen that I'm going to start you on.
Exercise prescribing and counselling is like any other interventional counselling. It includes, but is not limited to, firstly, indications and benefits. Second, exercise regimen prescriptions like frequency, intensity, time and type. Third, is the targets to achieve with the exercise regimen. Fourth is implementation, support and reference, as well as ways to incorporate into our daily lives. And lastly, challenges and solutions.
Before that, can you tell me what have you understood about exercise so far?
Exercise means moving your body.
Okay, yeah, that's true. And also, exercise has tons of benefits. So it can help, help us reach our healthy weight and maintain our healthy weight. And it also helps with our heart and lung function as well. So besides that, it also improves our muscle strength. And exercise also helps us to get good quality sleep. And it also helps with our mental health as well. Yeah. So since you are obese and also you have high cholesterol, I think it's very crucial for us to start you on an exercise regimen according to our clinical practice guidelines. Okay? This is because we want to prevent further complications from happening to you. Okay?
Okay.
Okay. So the exercise regimen that I'm about to start you is moderate intensity aerobic exercise. Okay, so you will have aerobic exercise for 150 minutes every week with 5 sessions per week, and each sessions will last around 30 minutes.
Actually, what is aerobic exercise, doctor?
So aerobic exercise actually means doing physical activity that requires our body to use oxygen to produce energy. So some will actually call it cardio. Have you heard about it before?
Oh yeah, cardio I heard.
So some of the activities included are swimming, jogging, bike cycling, and also aerobic dancing. And aerobic exercise is actually more for the heart and lung function compared to the muscle strength. Yeah. So have you tried any of these activities before?
No, actually I don't exercise at all.
We can always start with brisk walking first, and later on when your body gets more used to it, then we can incorporate more higher intensity activities.
How to make sure it's of like moderate intensity, doctor?
Okay, so theoretically speaking, when you're doing the exercise, your heart rate will be 70% of your maximum heart rate. But practically, so you can figure out the intensity of the exercise while singing and talking while you exercise. So this means if moderate intensity, you'll be too breathless to sing, but you can still maintain a conversation. But in high intensity exercise, you'll be too breathless to maintain a conversation. Okay, Mr. John, the target I hope that you achieve is that you lost about 10% of your weight after 6 months. Okay? So now you are 90 kilo, right? So in about 6 months time when I see you, you should have lost about 9 kilos.
Okay, I understand, doctor. But actually, I think actually quite busy. I don't think I have enough time to do that. Also, I think exercise for me is quite boring. How to help me with that?
Hey Abby, busy ah? I got you coffee.
Thank you so much. I wanted to see this patient, can I?
Oh, can.
Okay, so this is Mr. John, and he thinks that exercise is too boring.
Okay, hi Mr. John. I'm Miss Yasuda. I'm actually a physiotherapist here. So you mentioned that you find your exercise quite boring, right? Actually, if you need to do, for example, 30 minutes of exercise a day, all you need to do is, for example, just park your car about 10 minutes walk from your office. So every day, while going to your office itself, you're walking 10 minutes. Going back is already 10 minutes. That's already 20 minutes. And then, for example, when you want to choose a restaurant to eat, instead of taking your car and going out during lunch break, why don't walk for at least a 10 minutes distance or 5 minutes or so? To and fro is already contributing to the last 10 minutes of the exercise that you need. Besides that, you can also find more motivation by downloading certain apps. You know, nowadays, there's such apps like Walk, where with every single mile that you walk, you will actually receive some rewards, and that could be quite beneficial for you.
Oh, I see. Actually, there's a lot of good suggestions, Ms. Yasota. Thank you. Also, Dr. Abigail, thank you so much for your help. Yeah, I really appreciate it.
Okay, so you can see that the session is done by 3 persons. So Dr. Abigail, Prof. Ngan, and also Ms. Yasota. So I hope that you alone can do all the 3 tasks.
Thank you.
Firstly,
Okay, I remember.
Okay.
Mr. John.
Interesting case here. So this is Mr. Zori.
John!
Oh,
Wait, again.
sorry.
Farisha, clap for me. Okay, ready? Everybody ready? Okay.
Oh, I see. Start.